Good morning. Today our topic is acute pancreatitis causes. In the chapter 14 on SRB manual, we are going to talk about acute pancreatitis and causes. The part A describes the causes, part B describes symptoms, and part C describes the treatment purpose. So this video mainly for educational purpose, but people other than student can use it for learning. Pancreatitis is nothing but an inflammation of the pancreas. Here the acute pancreatitis means which will appear suddenly and last for days. So there is a word chronic pancreatitis is there. It is a chronic disease and which will take longer time to cure. So mainly causes, number one is idiopathic, gallstone, ethanol, alcohol, trauma, steroids, mumps, autoimmune diseases, scorpion bite, hyperlipidemia, hypercalcemia, and endoscopic retrograde cholangiopancreatography, and drugs. So we will discuss about each and every causes deeply. So let's see the pancreatic juice has three proenzymes like trypsinogen, chymotrypsinogen, and procarboxypeptidase. It also has amylase and lipase. The trypsin works on the protein, and amylase works on the carbohydrates, and lipase works on the fat. So here the trypsinogen and chymotrypsinogen will convert into the trypsin and work on the protein, and amylase lipase will work on the carbohydrate and fat as well as. So before going to causes, we should know about this enzymes. Premature activation is the main cause for pancreatitis. Let's see here the causes. See, number one is duct obstruction. The pancreatic duct obstructed by the stone and other causes, cancer, will lead into the premature activation of the enzymes. And acinar cell injury also mainly caused by alcohol and trauma. Then intracellular transport mechanism defect also will lead into the pancreatic. Here the gallstone. Normally gallstone from the gallbladder will pass through the common hepatic duct, sometimes which will obstruct the ampulla of Vater. Ampulla of Vater means common hepatic duct and pancreatic duct joining area, which causes the premature activation of the enzymes and injure the acinar cells in the pancreas, which leads into the pancreatitis. So gallbladder stone, it's one of the main causes. Alcohol also second main causes. And injury the grade 1 to 5. Grade 1 is only parenchymal hematoma, simple hematoma, there is no laceration. 2 is severe hematoma without duct injury. 3 is hematoma with distal duct injury. 4 is hematoma with proximal duct injury. 5 is injury at the ampulla of Vater, hematoma along with the laceration of the duct is the main cause. Then the hypercalcemia occur from the hyperparathyroidism, which leads into the sluggish flow of the pancreatic juice, main cause of premature activation. Then autoimmune pancreatitis caused by the antibody produced against the acinar cells. Number 1 is AG4 related pancreatitis. 2 is duct centric pancreatitis, the antibody produced against duct cells, which leads into the pancreatitis. So again the hypertriglyceridemia is a third most common cause. The hypertriglyceridemia, which leads into the overproduction of the chylomicron. This chylomicron will lead into the increased plasma viscosity and capillary plugging, which leads into the ischemia of the pancreas. Same time free fatty acids elevation also leads into the endothelial cell damage, leads into the ischemia of the pancreas. So activation of trypsinogen into the trypsin will occur after ischemia of the pancreas, which leads into the acute pancreatitis. Then pancreatic cancer will obstruct the duct, and cystic fibrosis, it's a CFTR1 gene mutation which leads into the sluggish flow of the pancreatic juice, and the infection caused by the endoscopic retrograde cholangiopancreatography. It's one of the main procedure to extract the stone from the ampulla of Vater. So some drugs also will cause the pancreatitis. Some of the drugs like azothioprine, furosemide, thiazides, sulfonamides, and estrogen, testosterone, which mainly cause pancreatitis, drug-induced pancreatitis. Then see endoscopic retrograde cholangiopancreatography.